I'm Dr. James Kelly, and my practice is known as Kelly Vision Center, and we have offices in New York City and Long Island. Cataracts are a clouding of the lens of the eye. There's a structure in the middle of our eyes called the crystalline lens, and it generally gets clouder as we get older. And the only way to rectify that is to remove that cataract, remove that cloudy lens, and replace it with an artificial implant. An implant is a synthetic device that's put in the eye after cataract surgery. They come in various different types and various different materials and sizes and powers that we will individualize to each patient's eye and whatever their visual needs are. Modern day cataract surgery is not your grandmother's cataract surgery, I can tell you that. We use a laser to remove the cataract, which is a really precise way to remove it. We're able to do the procedure often in 10 to 15 minutes. Because we use a laser to remove the cataract and we use these modern implants, many patients, believe it or not, can resume their normal activities a day later, just like with laser vision correction patients. A good candidate for cataract and implant surgery would be, first of all, someone who has a cataract. The way we determine that is during the consultation. We put a patient through a series of tests and we determine whether or not he or she may have a cataract. Can someone have a cataract and not be aware? Absolutely. I have patients that even, it's surprising to me, they have had cataracts for many years that are getting worse and they're not aware that they have a cataract. So they'll come to me and I'm often surprised at how poor their visual quality is. And I tell them, when in fact it's the case, hey, you have a cataract and these are your options to address it and get normal vision back. As with any surgery, there are risks. There's the small risk of infection, excessive inflammation. Sometimes patients have to undergo a second procedure to modify the result of the first procedure. Sometimes they have prolonged light sensitivity. This rarely happens, but when it does, we address it right away. Cataract surgery can be transformative in people's lives. Recently, I operated on a 48-year-old who had really horrendous cataracts. He stopped driving, he quit his job, he became homebound. At 48 years of age, he gained 50 pounds. He was really depressed. I wound up doing his cataract surgery and we were sitting in the office post-op day one from his second eye. I mean, both of us crying. I was very emotional. He's like, I have my life back. I want to get my job back. I want to start, transforming my life. So it has that type of impact on patients. I want people to know cataracts are really common and it's the most commonly performed surgical procedure in the United States. The technology is very, very precise. Recovery is very rapid. And if you think you have a cataract, please come in and see me for a consultation.